According to the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in the United States. Organizations like the Mental Health Association of New York City are providing many services for those affected by mental illness. Joining us now to discuss more and talk about this important issue, we welcome now the Vice President of Contact Center Services at the Mental Health Association of NYC, Anitha Iyer, and thank you so much for being with us.
Thanks for having me, Daren.
When we talk about suicide, obviously, many people didn't even know how prevalent it is in our society, but when you get down to the nuts and bolts of it, suicide is really, in many ways, preventable.
Absolutely. I'm really glad you said that. Suicide is preventable. It is rising nationally as well as in New York City. The rates of suicide are rising. However, people can reach out for help. We at the Mental Health Association of New York City are really proud to be able to offer services that provide recovery-oriented care to individuals who are in need, who are experiencing emotional struggles, including suicidality, and connecting them to a wide range of services. So we operate NYC Well, which I really want to highlight, which is a free and confidential 24/7 phone, text, and chat service that's really pioneered. Our city leads the way in the country in offering this service under the visionary leadership of our First Lady, Charlene McCray, through the Thrive NYC program. So individuals can call NYC Well, text us at 65173, or chat with us through our website and speak to a trained mental health professional who will engage with them, understand what's going on, assess whether they're experiencing any mental health or substance use related concerns, including suicidality, and connect them with a wide range of services that are available for resources for treatment as well as crisis intervention services.
Let me ask a question about this, because what are some of the reasons that we're seeing in the causes? Because as you talk about things rising, is there a particular trend that we're not catching that we should be paying attention to?
That's a great question. So nationally, we've noted that the 45 individuals who are 45 to 64 years of age have really been the group that has shown the most dramatic rise in suicide rates. And that trend is pretty similar within New York City as well. Now, New York City actually is lower than the national average in terms of suicide rates. However, the only acceptable number of suicide deaths is 0. So one of the reasons, and there are many reasons, suicidality, as is the case for any kind of emotional struggle, including suicidality, it's complex. There are multiple factors that really affect an individual's emotions, innate factors as well as environmental factors. But certainly economic stress can place a huge burden on individuals in terms of how they manage and what's available to them. And there are also other barriers that prevent people from seeking or accessing care early enough. So they sort of sit with their feelings, unable to really connect with someone who can support them.
Stigma, stereotype, a big factor here, because a lot of times when you talk about mental illness or you talk about mental health, a lot of people just sweep it under the rug because of the stigma and the stereotype. Do you feel the barriers are being broken right now?
I think that Thrive NYC has done a really phenomenal job in terms of trying to break some of those barriers, really by spreading awareness, making people understand that everyone experiences emotional struggles and that it's okay to reach out and try to connect with care. And that's why the impressive amount of advertising that's been put into NYC Well, so people are aware that it's just one phone call or one click or one text away to connect with a trained professional who can help you access the care that you need.
And so for people who want to get care and people who may know someone who needs care, what would you recommend?
I would tell them to call 1-888-NYC-WELL or text us at 65173 or chat with us. They can access the chat portal by going to nyc.gov/NYC-WELL and speak with a trained professional or a peer support specialist, an individual who's experienced their own struggles, who can help you, sort of figure out what's going on and navigate through your own path. And we can connect them with resources in their community, close to their zip code. Free resources as well as resources that they can access through their insurance, and provide support or connect them to crisis intervention services.
The effects of mental health. Many people don't know the effects of mental health, and unfortunately it doesn't play itself out sometimes until you get to the place of suicide. But for people who don't know about some of those effects, what are they?
Mental health concerns can be varied, and they can present themselves in multiple ways. It's complex, like I said. But if someone is concerned about themselves or a loved one, they can certainly reach out to us, and we can help them understand, help sort of assess what's going on, whether they're demonstrating any signs and symptoms that could be indicative of needing some more support. And we can certainly talk them through and collaborate in identifying some supports. For those who are wondering about whether is my loved one struggling with suicidality, some of the common symptoms are, the changes in things that people say. If a loved one is talking about suicide or talking about finding ways to kill themselves or starting to give away their possessions as though they're preparing for death or isolating or withdrawing, these are all signs to pay attention to and reach out for help on their behalf or on behalf of themselves. If they're noticing changes in their sleep patterns, like they're suddenly starting to sleep a lot or sleep too little, if they're suddenly more agitated or anxious or angry, if they're using substances more than they used to. These are all things to pay attention to, and if they reach out to us, we can certainly collaborate with them in figuring out what's the right connection to care that could prevent them from getting to a place where they can't come back.
What's the biggest misnomer about this whole thing?
About
suicide.
It's that there's nothing that we can do. It really is preventable. And if people reach out on behalf of themselves or someone else early enough, it is preventable. There is a lot that we can do to help the person that's in need.
Because we watch a lot of celebrities, and you hear a lot of celebrities, and you hear them, and the big question always becomes like, you look like you got it all together. You look like you have it all. What happens, and what are some of the things? Because if it happens to a celebrity, and they it's perceived that they've got it all together, the other person who, doesn't have the same amount of things, it could all be the same.
Yeah, I'm glad you raised that. It really is hard to know what an individual is experiencing inside from what you see on the outside, right? Suicide, as well as any kind of emotional struggle, really doesn't discriminate. It's prevalent in all racial, ethnic groups. It's prevalent across socioeconomic strata. So I really think the key is to talk to people, to pay attention to them, and to reach out on their behalf.
And so there's help for families, and there's also help for individuals. Talk about the family component, because that's major too.
Yes, absolutely. When an individual is struggling with emotional issues, it does impact their families. It does impact their caregivers. There are many resources for families, including family resource centers, some of which MHA, my parent organization, operates, where there are people that can support the family members, understand their needs, and help them navigate the system, which can be complex and it can be daunting, and connect their loved one with care, and also think about what supports do they need for themselves.
And so for people who want more information, they can call, 1-888-NYC-WELL?
Yep.
And you can find out there. And you said you can use a text and chat, and
yes.
those are also things.
We're 24/7, phone, text, or chat, and it's available in a multiple plethora of languages.
Oh, that's good. Well, Anitha Iyer is here with us. She's the Vice President of Contact Center Services at the Mental Health Association of NYC, and she's been our guest, sharing a little bit about suicide. As we said in the open, when it comes to suicide, it's actually the 10th leading cause, is that right, of death. So want people to get connected if you can. And thank you so much, Anitha, for coming and sharing with us.
Thank you for having me.
All righty, taking a quick break, but listen, when we come back, we'll have more show.